Hey guys, hi, this is my video on how to study clinical pharmacology. So when I studied clinical pharmacology, I organized my notes by dividing them into 4 basic scenarios. The first is patients presenting with a disease that only has one pharmacotherapy. So that's very easy. The second is a patient presents with complaints that are a side effect of a pharmacotherapy, and that's fairly difficult. The third is the patient has a severe infectious disease like endocarditis, meningitis, and pneumonia, and there are many nuances. There are many non-pharmacologic invasive things that you need to do first, and there are also nuances like age and immunocompromised status. The fourth is finding the right pharmacology if someone has tried the first line and is refractory or has gotten worse and has developed some other problem, and that's also fairly hard. So if the patient has a disease that has only one pharmacotherapy, it's usually an infectious disease that we're talking about. There are about 7 or 10 of those that are like that. The tick-borne diseases come to mind, and a human or animal bite come to mind. There are some others. You really got to cold memorize these, and I will go over this in a future video. Our second case is the patient presents with complaints that are a side effect of some drug that they took. So there are mnemonics for this in review books, but the clincher is that you have to know what is when it's preventable or reversible, and the patient can still get the drug then and in the future, like red man syndrome in the case of vancomycin, or when cases you have to avoid it like penicillin anaphylaxis. So this is another topic of a future video. Infectious disease. Patient presents with a severe infectious disease. There are many nuances. It's usually pneumonia, meningitis. So in this case, you have to be really advanced in your other studies, in your other systems, to really make to establish those connections in your brain where you're able to put 2 and 2 together in a problem. So in your studies, memorize the etiologies of the diseases, like who gets them, first before you even attempt the practice questions that you do. The fourth case is the patient is refractory to initial treatment. So when I say that, I also mean that the patient could get worse or develop some other problem. So I want you to take a sheet of paper and divide it into 2, make it asymmetric. The upper 3/4 should be inflammatory disorders, and the lower 1/4 should be infectious disease disorders. And start making notes on the important ones you encounter in your QBank explanations. And I will also make a future video about this. And you've reached the end of my video. Please like my videos and subscribe.